Isabelle Troïtzky. I'm the program manager for the Secretariat of the Global RA Network. I'm joined today by two members of the network, Cheryl Koehn and Rozalina Lapadatu. Cheryl Koehn is a 32-year survivor of rheumatoid arthritis and president of Arthritis Consumer Experts. She led the founding of the Global RA Network in 2016, and she's a pioneer of patient participation in rheumatology research and has led patient engagement in the development of and the advocacy for rheumatoid arthritis models of care in Canada. Rozalina Lapadatu is an RA patient and advocate and the president of the Association of Patients with Autoimmune Diseases in Romania. The Global RA Network was founded in 2016, as we said, by RA patient organizations and leaders from 18 countries in Europe and the Americas. It was formed to build international relationships and identify and work on common goals and initiatives to improve the life of patients living with RA around the world. The RA Dashboard is one of the many strategic advocacy initiatives that the network and its member organizations have implemented to improve the treatment and care of patients with RA. This includes a survey that was launched in 2017 and called Patient Experiences of Rheumatoid Arthritis Models of Care, an international survey. The RA Dashboard is an easy-to-use tool for visualizing the status of rheumatoid arthritis care and for monitoring progress on key components of a country's RA model of care. So to start, I'd like to ask my first questions for Cheryl. Why did the network develop the RA Dashboards?
Always a great fundamental first question, of course, when you're launching a new tool. To help people like myself, like Rozalina, and the members that we represent. First, Isabelle, rheumatoid arthritis is the most common autoimmune inflammatory form of the disease. So arthritis, the global word, covers 100+ different types of disease. Rheumatoid arthritis affects approximately 1 in 100 people worldwide. So it's not common, but it's also not uncommon, right? 1 in 100, you can walk into a restaurant and somebody's gonna have rheumatoid arthritis. The thing that really distinguishes rheumatoid arthritis is that it reduces a person's quality of life, along with bringing about disability because of joint damage. And it's one of the world's leading causes of disability, Isabelle. So despite its prevalence, and the cost to society and at the individual, human level, rheumatoid arthritis models of care, they vary from country to country, and many gaps in inequalities exist. So the Global RA Network developed what we're calling the RA Dashboard to help patients like myself and others who are represented in the Global RA Network and other stakeholders get a better, understanding of the disease and the gaps in models of care in countries across Europe and, of course, in the Americas. So there's no standardized RA model of care that exists today in Europe or the Americas. This disparity, obviously at the individual level, leads to huge frustration. Imagine being Rozalina or myself, and I'm in one neighborhood in my country, and I'm getting a standard of care. Meanwhile, on the other side of my community, or even across the country, that person's getting drastically different, in many cases, inferior level of care. So whether they can't get a timely diagnosis, the diagnosis perhaps isn't accurate, they can't get in to see a rheumatologist because there's too few of them in that particular community or country. And they can't get medication reimbursement, which is really critical, particularly early on in the disease to manage it. So the RA Dashboard is the first of its kind in the international RA patient community and was developed by the leadership of the Global RA Network and our 18 member countries. So super excited. In a nutshell, Isabelle, that's what the dashboard is and why it should exist.
Thank you, Cheryl. Rozalina, can you tell us what the key findings were?
I will start with the time to RI diagnostic and the waiting time for the first rheumatologist visit. This is a serious challenge in every member country of the global RI network. This is what we talk many times, and difficult to find a solution when you have a shortage of rheumatologists. On average, RA patient in a network country wait nearly 2 years, 22 months for an accurate diagnosis. Let's say that 51% of the RA patient in our network countries had to wait longer than 3 months for their first visit to rheumatologist. And the 33% of the patient complain that they didn't see the rheumatologist as frequently as was recommended by the international guidelines, even we are talking about American guidelines or European guidelines. For example, we found that 40% of RA patients in Romania wait more than 3 months for a first visit with rheumatologist, which is significantly above the recommended time for one, which it's around 4 weeks. Also, we have to mention that several member countries in the global RA network, including countries like Israel, Colombia, Brazil, Ireland, and of course Romania, reported not being able to access RA statistics in their countries. In those countries, government are either not collecting data on RA or are not making it public, which is very difficult because without this data, it's impossible to provide a picture of how RI affect a country and limits arthritis care planning and measure on the progress in the rheumatoid arthritis awareness, diagnosis, and treatment, and of course, self-care. Without this data, it's impossible to improve the quality of healthcare for RI patients.
Thank you, Rozalina. Finally, Cheryl, can you explain what the Global RA Network will do with the RA dashboard?
Yeah, you know, really what the Global RA Network is a group of colleagues. We call them brothers and sisters, don't we, Rozalina? Who really use the tools developed by the Global RA Network to advocate. It's what we do. We, as people living with the disease, own the moral authority to speak to policymakers and say how what they are giving us as healthcare is either helping us or not helping us. In the case of the dashboard, we know from our international models of care survey, so that was the survey we conducted when we first launched the network, that there are significant gaps amongst our 18 member countries. We also learned that during the pandemic, data is the actual evidence that drives good, healthcare decision-making. The public now has a general awareness of the importance of data. So we felt, Isabelle, sort of piggybacking on top of this general awareness now that the public has about the importance of data, that we can then turn that and show them how that really matters in rheumatoid arthritis. And there's this old saying in data collection, I know Rozalina's heard it many times, you can't fix what you don't count. So if we don't count what's happening to people, either how many have it, how well or how bad they're doing with it, how many rheumatologists people have, we will not fix the problems that people like us face every day. So, we've learned a lot. And now when we launch this tool and our member organizations can look at the dashboard, they're going to be going home from the EULAR meeting, from the European League Against Rheumatism meeting. And they're going to take that data or even the lack of data, Isabelle, and they're going to champion where improvements need to be made with their own government. For a country like Romania, for example, and Rozalina pointed out in her comments that there are many gaps in the data provided to her as an advocate and a leader of her organization. She can take the missing information and highlight that to her government and say, well, Canada has it. Why doesn't Romania have this data? So it is a way for all of us to hug each other and lift each other up, Isabelle, to make the argument that we are worth counting, that our problems are worth counting, and that our problems are worth fixing. So this requires robust RA data and collaboration between all the different stakeholders or audiences, including patient organizations. Rozalina and I would argue we're the most important people at the party. So unless you bring us in, unless you let us through the door, you're never going to fix the problems that we face in our everyday lives, either individually, as small groups, or as very large global populations of patients. So that's really why, you know, we need the dashboard, and it's what we're going to do with the dashboard that if in the end, Isabelle, really matters. We're going to take our data and we're going to turn around and say, here is where we have gaps. Here is where we're doing well. Help us compare favorably to other countries in our network. So it takes a village and it takes data. And that's why the dashboard exists today and what we're planning on doing with it.
I want to have a small comment and to tell you that missing the data, it's like have no problem. It's like this problem is not exist because you don't have the data to show that you have a problem, and the problem, it costs you this kind of money for treatment, for medical tests, for day off from office, and so on. So you don't have all this this information. It's like you are not existing. I feel like I'm not existing because I'm not part of this data.
Mm-hmm.
So it's very important, and comparing with other countries, like Cheryl said, other countries' data, it will help me to talk with Romanian authorities and tell them, look, here we are not existing, but other countries, look, can build a health policy based on data and trying to help people. We don't have data, we cannot do anything for these people.
Yeah, that's a great point, Rozalina. And finally, Isabelle, you know, people like us on the ground, you know, people who aren't involved in organizations, there are ways they can get involved. They can sign up and become an advocate with Rozalina's organization as well as ours. And they can learn about the importance of data, how it fuels health policy, and how health policy is actually what delivers health care out in every community in the world. So this data is incredibly valuable. It will be invaluable to the arguments we make to government to improve rheumatoid arthritis models of care, which is our raison d'etre as a global RA network.
Well, thank you very much, Cheryl and Rozalina. I think we understood the importance of that RA dashboard for the many countries we represent or the network represents. So thank you again, and I'll encourage everyone who's seen that interview to visit globalranetwork.org to find the dashboards and learn more about RA and the data behind RA or the lack of. Thank you very much.
Thank you. Thanks, Rozalina.
Nice to see you, girls.
Thank you.